Hello friends, in this video, I'm going to explain you about paralysis of vocal cords in stroke. We at HealthQ Rehab offer facial rehabilitation and aesthetic physiotherapy services. We are a team of professionals including speech therapists and physiotherapists who work towards helping patients improving their facial and aesthetics at the same time communication related challenges. So in this video, let's understand about paralysis of vocal cord in stroke in a nutshell. Let's get started. When a person suffers from stroke, the region in the brain that is responsible for your language and communication gets impacted. But at the same time, the area in the brain that controls your larynx or vocal cords is also affected. That's where there is paralysis of vocal cords. Usually it is one-sided, but sometimes it is on both the sides. So now let's understand the anatomy behind it. Your vocal cords are controlled by muscles innervated through vagus nerve. This is a cranial nerve. Your vagus nerve originates or starts from the brainstem, specifically from nuclei in medulla oblongata, and it sends branches to your larynx via the recurrent laryngeal nerve and superior laryngeal nerve. Whenever there is stroke in the brainstem, the pathway that carries information from the brainstem to your larynx is affected. This interrupts the signals reaching to your larynx and affects the speech production, leading to partial or complete paralysis. There is one more pathology due to which the larynx can get paralyzed. That's when the paralysis or stroke is in the brain or the cerebral cortex. If it is a cortical stroke, the patient usually will have a mild hoarseness in sound because of the two sides of the brain areas being present to help to control the sound production. But when there is damage in the brainstem level, that's where there is high chances of complete paralysis, leading to more severe and persistent paralysis because the actual motor nuclei itself is damaged and paralyzed. So, what will be the symptoms when there will be paralysis of your vocal cords? Let's understand that. Number one here is hoarseness or breathy voice. Patient will sound hoarse or breathy whenever he or she will attempt to speak. The loudness will be reduced significantly. So, the patient will choke very easily while eating or drinking or trying to swallow. The patient will have weak cough reflex and will easily get short of breath while speaking. In these kind of patients, the risk of aspiration is very high. Food or liquid, whatever they consume, can get easily entered into the air pathway. If both these two cords are severely paralyzed and stuck in the midline, the airway can become dangerously narrow, leading to stridor or respiratory distress. So how one can come to the diagnosis of this condition? Typically, the diagnosis is done with laryngoscopy, speech and swallowing evaluation, and with the help of MRI or CT scan. So now let's talk about the management or treatment of this condition. The rehabilitation plays the most critical role when it comes to management of such condition, which is the paralysis of vocal cords. Here, the most important role is of exercises or speech therapy. Voice therapy or speech language therapy basically focuses on number one, exercises to strengthen the remaining vocal muscles. 2, breath control and phonation training. Number 3, compensatory speaking strategies. The next therapy is swallowing therapy. Here, therapy needs to be done if the patient is at risk of aspiration. Next comes the medical management. Medical management could be in the form of medication or surgery. Injection laryngoplasty, thyroplasty, or reinnervation surgery are some common procedures that has been used, but this is only used when the conditions are not improvable with the help of just rehabilitation. Treatment of such condition, multidisciplinary approach works the best, where the primary role is of speech and language. Even chest physiotherapy plays a very critical role, breathing exercises, retraining the facial muscles to improve the expression and communication ability, diet and nutrition practices that are ideal based on patient situation, and cognitive behavior therapy when combined together gives optimal outcome. And a good therapy and a good involvement of healthcare professionals like ENT surgeons, neurologists help the patient to improve in a holistic manner. Majority of time, people recover and see gradual improvements with the right type of therapy. Some cases recover partially within months and some take years' time and sometimes more too. But if the paralysis persists for more than 1 year, then doctors usually consider surgery as an option. So friends, this was in a nutshell about vocal cord paralysis. I hope you found this information helpful. If yes, make sure to like this video, share this video with your friends and family members, and do not forget to subscribe to HealthQ channel. On that note, I'll end this video here and I'll see you in another video. Thank you.